I was interested in becoming the chair of Antibiotic Research UK really when I started to look at the impact that antimicrobial resistance was having. And it was very clear from not reading just the WHO reports, but also some of the aspects that we were facing here in the UK, that this was a problem and it was only getting worse. And if I could try and do something, even a small thing, to help alleviate that, then that's what motivated me. What I've learned, I think, from being chair designate for the last 9-10 months of Antibiotic Research UK is that how little is being done collaboratively in this space. And I think there's a great role for this charity to bring together like-minded people and interested groups to do more and to work together, because clearly we're going to be more powerful as a collective force than individually. If money was no object, I think we would be looking to reach out overseas. What we do in the UK is good, and we've got some great initiatives. And having a background in community pharmacy, I've seen that at close hand. Where we know that there are problems are elsewhere, other countries where antibiotics are just too freely available. Charity, to me, has a great vision, and it's focused in 3 specific areas, not just about antibiotic research, of course, although that's the principal aim, but also working in patient support and also education. We need to strengthen all 3 of those areas, but the research outside of it and finding out what we can do with clever people to try and maximise the efficiency and effectiveness of existing antibiotics and work to find new solutions is clearly going to be our priority. We've got a really good vision for the next 5 years, not just about looking at how we can use existing medicines to better effect, but also, really importantly, to try and reduce the demand for antibiotics. And I think that that's where we will see the real effectiveness of the charity over the next few years, reaching out to prescribers, reaching out to patients and educating them that actually the vast majority of time antibiotics are not needed. In order to reach out to prescribers, we need to have an effective communication strategy. And I'm really pleased to see how Antibiotic Research UK has devised some new literature and leaflets to work with community pharmacies in particular, like Well, but also with general practice as well, in order to educate people about the use of antibiotics and the effective use of antibiotics. What we also have to do, of course, is to make sure that patients understand what antibiotics are actually effective against, and that just because they have some sort of respiratory tract infection that they feel they're not going to leave their GP surgery without a prescription for antibiotics. AMR week is 18th to 24th of November. We all need to do our part to highlight this particular issue and the work that Antibiotic Research UK is doing. Personally, I'll certainly be donating some money, but also using social media and making sure that my contacts and my network is fully aware not only of the great work of Antibiotic Research UK, but also the issues that we're dealing with in terms of antimicrobial resistance.